Questions?
Governor, is the state ready for the crush of people that are going to be going to the website all to unlock?
Well, I think we had, after this story broke earlier today, I think we had 250,000 visits to the state's website, which processed, people got on the site, but you can't actually sign up until tomorrow. So I think the website will be in good shape for this. The call center has done a really nice job taking care of folks who are 75 and older. We do want to continue to make that available as we get into some of these other populations for people who can't access an appointment through the website.
And when you say to those people who are 75 and over, 50% of them have been vaccinated, but 50% of them haven't.
Well, they're obviously still eligible and can continue to make appointments. And remember, a lot of the appointments that are going to roll through today, tomorrow, Saturday, and Sunday are slots that have already been filled by people who fall into that category. So I think we'll continue to see that number climb.
Governor, you say it's going to take at least a month for everyone who's eligible in this next group to get an appointment. I heard that correct? I guess the question then becomes, will the next group then have to wait at least a month before they're eligible? We're getting questions every year. Teachers, that big group of essential workers. I mean, what kind of timeline or metrics are we looking at before we move on to that group?
Well, we're still on point with the phase 1, phase 2, phase 3 that we set up. I lose track of time here sometimes. I think it was probably in December, was it? We're still pretty much on track with that. And so what I would say is that we believe we're still on track with the basic schedule that we set up when we started.
But are we looking at 50% of this next group needs to be vaccinated before we move on to the next group in phase 2?
Well, we certainly want to make sure that enough of these folks actually get their first dose so that there will be available capacity when we go to the next group. I think it's important for people when they become eligible that there in fact be slots that are available for them. And the other thing we don't know the answer to is where we're going to be on supply. I've now been on a whole series of calls with governors with the new administration, and on every single one of those calls, the two big, there are a lot of them, but the two big messages that come from governors are, number one, we understand how important it would be for us to have more than 1 week's worth of ordering capacity. Now, I've said that to this room a number of times, and I've said it on that call. So have many other governors. One of the things that would really help with respect to our ability to schedule stuff would be if they could give us a 3-week commitment. If they can give us a 3-week commitment, like an official 3-week commitment that we can order against, then we can say to the provider community, this is what we think your appointment opportunities are going to look like for the next 3 weeks, and then we can let people book 2 or 3 weeks in advance, which would provide a lot more certainty to the folks out there who are looking to make appointments. So that message has been delivered over and over again. The second message has been, most states now have the capacity to do far more vaccinations than we actually have supply, because we were led to believe that by the time we got to the end of February, there was going to be a big increase in available capacity coming from the feds. And I certainly hope that at some point, what Secretary Sutter's talked about, that little increase from 120 to 139, I hope that's the beginning of what will be a really significant run-up. 110 to 139, yeah.
Governor, any sense of why the percentage of 75s went up so quickly last week? Was there, did the companion program help? And then also, can we just get a little bit more clarification on the companion program? Because I don't know if you saw Melrose and some other places are starting to use it, but obviously it was for the mass sites to make sure that we get them into that more efficient system.
So we have some statistics on the companion program. The big thing I would say about it is the vast majority of the people who actually got a dose as a result of being a companion were for the most part over the age of 50, which I think is a good thing. And I can just tell you anecdotally that when I was in Springfield on Saturday, I saw a lot of people in wheelchairs and other physical supports who were there with a younger person, not a lot younger, but younger, who was helping them work their way through. And we have seen a significant a significant flow of people over the age of 75, pretty much since we started with that population.
Governor, could I ask you about
Say again?
There are about 68 towns that are no longer going to be able to give out vaccines. Are you going to expect any pushback from them? And how does this streamline the process not sending vaccines to an individual community?
Well, keep in mind that we hope and anticipate that a lot of folks at the local level who aren't part of a collaborative or who don't want to be part of a collaborative will continue to help us with hard-to-reach populations, okay? We know there are people out there who are just going to have trouble getting to any site, and that's one role we believe communities are best suited to solve for. Part of our goal here is to, I mean, the big lesson we've taken, we started with a very deliberate and very particular, and I would describe as very equitably framed process at the beginning of this. But the big message we got from the public was vaccinate, vaccinate. And there's no question the fastest way to do this is with high volume sites. Now, it's worth pointing out that we have 4 county collaboratives right now that have been operating for several weeks in Berkshire County, Barnstable County, Franklin County, and Worcester County. There are 3 of the 4 counties that have exceeded the statewide average in the number of people in their communities who've gotten a first dose. Berkshire County is number 1. They're over 15% of their community, their county has received their first dose. Franklin County is number 2. No, Barnstable's number 2. They're at 14. Franklin County's number 3. They're at 13. So those regional collaboratives, which have now been running for several weeks, the county-wide ones, have proven to be pretty effective. And there are several other collaboratives that are smaller. I think we have what? I want to say like 13 or 14 all in, 13. Sort of hard to reach areas. There's not a lot of other options or availability there. They work because we can give them a significant amount of supply and they can dish it out in their communities and make that work effectively. But if we're going to do a lot of people quickly, you got to be doing more than a couple of hundred, one site at a couple hundred a day across, multiple sites. You got to be doing, well, I think the regulations from DPH are 750. You got to be doing at least 750 a day.
So does this mean a site like Marshfield, I asked about it to my parents went there.
Marshfield is a regional site.
It's regional, so but does it have to be open to the entire state, or can they stick to 10 towns or something?
They need to be open to the state, but let's face it, most of the folks who are going to go to a site like that one are going to live in Plymouth County. I mean, I talked to some of the folks from that site over the weekend, and they basically serve, what I would describe as the area around them. Most of these places do, but none of us want to get one more phone call from somebody who says, the closest site to me, right? Closest site to my mom, all right, is the next town over, which is in a different county. And she couldn't go there. That just doesn't make any sense.
Can you follow up on that? If a local municipality opens it up to non-residents, would they potentially?
You gotta deliver on the volume requirements here, because this is about speed. The faster we get through, the higher the number of doses we deliver every day is going to drive how fast we get to the next group. And the one thing that the experience of the past 3 weeks has demonstrated is, larger enterprises can deliver a heck of a lot more vaccines more quickly, which is really important.
Can you explain a little bit? That they have 2 medical conditions. Do they need a referral from the doctor, or is it the honor system?
It's an attestation process for the comorbidity determinations. And, I've talked to governors, Secretary Sutter's talked to Health and Human Service secretaries in other states. It is based on an honor system. And I can tell you that based on my conversations with other governors, people for the most part, and I've said this many times here, they follow the rules. People do follow the rules. And, will there be examples or incidents or circumstances where people don't? Maybe. But I think the overwhelming majority of folks try to be honest about this stuff.
Is there going to be a way that you will monitor to see if people are following the rules, and if they're not, we should make changes?
Well, in the attestation piece, that would be a tough one. I mean,
So there's no way to check.
well, if somebody shows up and says one of their, I mean, if somebody were to show up at one of these sites and they were to attest that one of their 2 comorbidities was obesity, and they, you know, were built like you, Steve, that obviously probably wouldn't, they probably would not be able to do that. But I think the goal here is to recognize and understand that other states have been in this same spot, and everybody's kicked around a million different ideas about how to create structure around this, and in the end, people basically decided that the honor system was the best way to go.
How much of a role did public pressure play in your decision to move forward to this phase? You said the big message you got for people was to vaccinate. So did that play a role?
This is actually, in the guidance we put out back in December, this is about when we said we were going to get to this phase, the 65 plus. I mean, it could have been 1 week or the other, but it was basically the end of February. So we're pretty much consistent with where we thought we were going to be.
So it didn't play a role?
I wanted to make sure we got a lot of 75-year-old plus people through, and, you know, thankfully we have.
Governor, we've learned the legislature's new COVID-19 committee is planning an oversight hearing on your vaccine distribution program. Your response to that, defend it.
When we talk all the time to the legislature, I talk to the Speaker and the Senate President over the weekend. Mary Lou does calls at least once a week with both the House and the Senate. We provide them with a lot of material and information, and obviously we'll look forward to talking to them about this.
The narrative for a while was that Massachusetts trailed the nation in vaccinations, and this was going terribly. And now we're hearing about top 10s and moving up the leaderboard.
Number 1 among those top 24 states that have more than 5 million people. Yeah.
Moving up like Tiger Woods on the leaderboard, right? So what changed? I mean, what did you do to change this and get the state headed in the right direction on vaccines?
Well, keep in mind that we said at the beginning of this process that we were going to be slow out of the gate because we were focused on some hard-to-reach populations. I mean, I can get plenty of people from the mental health and developmental disability and homeless community here, and we could line them up from one end of this room to the other, and they would tell you why they were both surprised and relieved and grateful that one state chose to put those folks at the head of the line. That didn't happen hardly anywhere else. And you're talking about hundreds of sites. I know it's thousands. I was just making sure I didn't overplay my hand there. But, and we were also one of the few sites that made a decision to go vaccinate within our correctional facilities. We were also one of the few sites, one of the few states, and I think, again, we may have been the only one that put PCAs, personal care attendants, and home health aides at the top of our list. And one of the reasons we did that is because PCAs and home health aides work with, in most cases, either seniors or other people who are not senior, who are dealing with other disability issues, and are in constant contact with them. And we felt it was important to vaccinate them so that they didn't make the people that they were looking to serve sick. And we also put, I mean, the federal program around long-term care and SNFs was a federal program, but we put a lot of work into making sure that that was done in as thorough and as aggressive as it possibly could be. And it took longer, but, you know, we got 90% of our residents in SNFs vaccinated, and I think almost 70%, 80% of staff, which is literally like 30 points higher than the national average on that one. But that stuff took a long time. So I knew coming out of the gate we were going to be slow, all right? And our goal was to pivot to this regional collaborative, high-volume process after we got done with those groups and healthcare and, you know, hospital workers. And frankly, you know, the people in Massachusetts also responded to this. They signed up, they got appointments, and they went, and they got vaccinated, which is good.
Are we doing enough to address vaccine inequity? There's a group that's having a news conference in a little bit, saying that as of last week, white residents have received 12 times more doses than black residents, and 16 times more doses than Latinx residents. Are those numbers accurate, and is the state doing enough to address their concerns?
Well, one of the reasons Commissioner Burrell reached out to those 20 communities personally is to say that we're going to work with them to figure out how we can enhance vaccination efforts in those communities. I mean, generally speaking, you know, our numbers relative to the rest of the country in terms of percent of the population that's black, percent of the population that's Asian, percent of the population that's Latinx, our numbers are better than the national averages, okay? But the national averages are nowhere near where they should be. That said, there's also a significant number of people, as we've been collecting this data, who are listed as unknown. And so one of the things we've asked the Department of Public Health to do is to take the folks who are listed as unknown and figure out for us where they live, you know? Because we do know the zip codes of the people, generally speaking, because, you know, you gotta tell us where you live. And I want to see what that data looks like so we can draw some conclusions about both how to improve our process and where some of those folks who got listed as unknown actually live, so that we can at least estimate if they belong to certain communities or not. But we're going to continue to invest in the local delivery systems that are the trusted delivery systems in those communities. We're also going to develop, hopefully with them, some campaigns that may even involve, you know, door knocking and stuff like that, to try to see if we can get folks to come get vaccinated. So yeah, we have a lot of work to do here. We agree.
Is this still an issue of reluctance on some of these people to actually take the vaccine, not so much that they can't get an appointment?
You know, it's hard to tell. I think there were appointments available at the Reggie Lewis Center over the weekend, right? And we worked hard with a lot of our colleagues in Boston to try and get folks there. And we've even set up, the city of Boston has set up days or times that are particular for folks in the community and that are available to sort of trusted voices in those communities to bring people to get vaccinated. But we definitely have work to do there, and we know that.
Governor, today you expanded out the eligibility to people who suffer from moderate and severe asthma, even though that's not included on the CDC's list of exacerbating conditions. Why don't you extend that to conditions like type 1 diabetes, hypertension, and those other things, other conditions listed that might exacerbate those?
The main reason we did this with asthma and sort of went away from the CDC guidelines is it really is an environmental and economic justice issue. There's tons of studies that have been done that demonstrate that at-risk communities and communities of color have historically had higher rates of asthma, child asthma, adult asthma, and a lot of that has to do with decisions that were made years ago with respect to how people chose to build neighborhoods and communities, and it's a legitimate issue, and we view it as much as an equity issue as a medical issue.
I think you're saying that those same inequities exist in things like type 1 diabetes. So are you considering adding those conditions in as well? Is that one of the things?
I really want to make clear to people that this asthma issue needs to be dealt with now. If we get guidance and advice from other folks in the medical community about other stuff, we'll certainly take it under advisement. But this asthma issue is a legitimate issue, and it's a legitimate equity issue, and we want it dealt with right out of the gate.
Governor, were any of the sites doing anything wrong? Were any of the sites doing anything wrong as far as letting people get vaccinated who may not have had the appointment? We were starting to remember hearing it in Danvers, but was that corrected, or now is everybody on the same page?
Boy, I think so. I mean, keep in mind that, you know, we get a lot of phone calls from people saying, I saw somebody at a CVS or a Wegmans who was getting a vaccine who wasn't over the age of 75. Well, you know, they could be a healthcare worker, they could be a PCA, they could be a home health aide, they could be a lot of different things, and they would still qualify. And I think, again, I think people for the most part are anxious to get vaccinated. I also think people for the most part have, since the beginning of this thing in Massachusetts, the overwhelming majority of people have, you know, tried to play by the rules, whatever they were. And if we come across providers who are not following the guidance and the rules that we've developed, we'll deal with them.
Are you okay with the Cape Cod situation? Do you think the government satisfies all those people even on the outer page?
Well, the thing to remember here is that Barnstable does have a collaborative in place. It might feel more like a competition to the people who are in it, but it is a collaborative. And between Cape Cod Hospital and the community health centers and the local Board of Health in Barnstable, as I said, you know, they are currently sitting at 14.2% of their population vaccinated, which makes them second only to Berkshire, in terms of the number of people in their county who've been vaccinated with one dose so far. I mean, they're performing well, and we'll continue to work with them to expand capacity and to make sure they have access. But, and they've also gotten, some of this county stuff will be up on our public report. Is that tomorrow? Okay.
Governor, most of the congressional delegations, several congressional delegations, call against for the pre-registration system. Your thoughts as more people continue to call for that kind of?
Yeah. The hard part, first of all, we're looking at it, and we're talking to folks in other states. The big challenge with that is if somebody is within 10 sites, it's very hard to figure out the algorithm around how you would actually structure that on a pre-registration system, especially if you're talking about 3 or 4 weeks, or maybe more, depending upon the size of the universe that's eligible. What would be really great, from my point of view, with respect to the congressional delegation, would be this issue around visibility, right? I would love to have the congressional delegation urge the Biden administration to give states 3 or 4 weeks of solid right? We could then say to people, it's not just next week that's available, it's the next 3 weeks or the next 4 weeks. And people could go on the site and they could take all of the sites that might be near them. And remember, you know, there's a lot of sites that most people have access to at this point. They could figure out if they want to get it first week, second week, third week, or fourth week, work it against whatever's on their own schedule, and book it. And this, to me, in some respects, you know, the message we get from the feds is, you're not going to get any less, right? Which is helpful, but it's not, you can order now, 3 weeks out, 4 weeks out, and that order will be validated. Because if we could do that, then we could make decisions about where the vaccine is going to go over the next 3 or 4 weeks. We could say that to the provider community. People could then put appointments up on that, and people could then book on that. So what I would really like to have the delegation do is push the administration to give states a bigger window to book appointments, because that would, many cases, would solve for a lot of people the complexity about getting an appointment.
If you're not going to get any less, can't you then just maybe book out not all 100% of the appointments, but maybe 50% or 75% of the appointments, so somebody can go on now and say, yeah, I'm going to go in 2 weeks, and book those now, and as you get closer, then add them?
So there are 2 issues associated with this. The first is certainty is way better than maybe, all right? The second is if you had visibility on how much you were going to get, you could basically distribute a bunch of it out and tell people, you're not going to get any less than this. And you could put 75% of it out there and say, that's hard and that's solid. You got nothing to worry about. And then you use the other 25% as time goes by to figure out, based on how people choose to schedule appointments, where you need to move it from one place to another. But without the certainty, it's really hard to create the same certainty among the provider community that's actually administering the vaccines and staffing their sites about what's actually going to be there for them. And the last thing we want to do, the last thing we ever want to do here, is end up with people booking appointments. I mean, this happened in a lot of other states where people booked appointments and then they got told either the day before or the day of that their appointments, like thousands of them, weren't going to be there for them because there wasn't any vaccine. So the one thing we've tried to say from the beginning of this is if you have an appointment, you're going to get a vaccine. And I just want to make sure that we continue to be able to do that going forward.
Thanks, guys.
Thanks, everybody.
We're talking about disability list, people in the 50 to 64-year-old age group,
Well, keep in mind that as we go through this process, particularly when we get into particular targeted groups, like doing staff in congregate care and, you know, folks with mental health issues and developmental disabilities and homeless folks, you know, we've already vaccinated a lot of people who are under the age of 70. They just, people who work in hospitals, the folks who work in nursing homes. We've vaccinated PCAs and home health care aides. We've already vaccinated a lot of people who are under certain ages. The one thing we have also learned through this process is you've got to be really simple, because these are big numbers and it's something people are really focused on. And so from our point of view, the nice thing about going from some of these targeted groups that we felt we really needed to get to for public health purposes to the age groups is, you know, age is pretty clearly defined. And I think from our point of view, that's a better place to be. When we get into some of the other, the employer categories, obviously, again, you're going to get into populations, hopefully at that point, that are mostly below the age of 65, because we will have dealt with, through the housing stuff and the long-term care stuff and the assisted living stuff and the existing appointments, a lot of the folks who are over the age of 65 to begin with. And then you're going to end up in a situation where you are talking about 65 and less. But we've already vaccinated a lot of people who are between the ages of 30 and 40 who work in, you know, group homes and work in nursing homes and work in emergency rooms and hospitals. So I kind of like doing this age piece, especially since so much of the COVID data demonstrates that people over the age of 75 are the most at risk of losing their life, and people over the age of 65 are the next most at risk.